every bite of every meal that you or an animal is consuming that is not supporting your health is creating this damage, creating this inflammation, and leading to this insidious decay of our body.
Hey, I'm Dr. Ruth Roberts. I am so excited. Our guest today, Dr. Dr. Marlene Siegel, will be joining us in just a few minutes. She's having a little technical difficulty, but if we didn't have technical difficulties, how much fun would it be? In the meantime, there's a couple of things I want to keep you updated on. We had an amazing webinar last night to start talking to our holistic pet health coaches and to help us potential students understand all of that we are doing in the program, all of the changes we're making, and all of the successes that the coaches are having. So Audrey was there with us last night, one of our certified holistic pet health coaches, and she gave an amazing testimonial, which really was so flattering for me. So if you are at all interested in learning more about this program, I am going to drop this link about where you can book a call. Noor Alabey is one of our students that lives in France. Comment ça va, Noor? Je suis, yeah, because I don't speak much more French than that. If it's in Serbian, I've got more talent there. Welcome. Glad everybody is joining us. We've got 39 folks in, which is super exciting. And for those of you that do not know her, Dr. Marlene Siegel has been in veterinary medicine for a little bit longer than I have. She is a pioneering figure in integrative veterinary medicine. She graduated from the University of Florida College of Vet Med in 1985 and established her own practice in 1987 after gaining experience in a couple of different veterinary center practices. And her current practice, Pasco Veterinary Medical Center, offers a wide range of alternative therapies and detoxification services. And she also provides online courses for pet parents and veterinarians, along with developing her own raw food, pet food, and supplement company. So, Dr. Marlene, welcome. How do you find enough time to sleep?
I do. I fit it in because sleep is very important and sleep hygiene is something I really work hard on. But I think there's a wrinkle in time for me, thank goodness, because I don't know how I fit it all in, but I do seem to fit it in. Maybe because I'm single. I don't know.
Great. Amen. Amen. All right. So, what Dr. Siegel is going to do today is dive into the body's 6 organs of elimination and detox. And I think this is a really important thing because the level of exposure we have to all of the garbage in the world, and then the fact that our pets are really behind the 8 ball because their endocrine systems are not competent, they just are struggling. So, take it away. Really glad to see you here.
Thank you. I did put a little slide
And
deck
if you're,
together.
yeah.
How do I do the slide deck?
So down at the bottom, you should see a present button.
Got it. Okay.
Okay, cool. And while you're doing that, I'm going to shut the door because all of us, the fleet of
share screen.
yard care guys are here.
Not the screen I want to share. All right, you got to tell me when you can see this screen because I click on present and I click on share screen.
Mm-hmm.
But it's share screen to easiest monitors. Okay, I'm just going to click share screen, and it keeps showing my ad block, but not my presentation. So let me close that. Let me close that. Let me close that. I don't know how to get to it.
Okay. If you would like to email it to me, I can grab that and share it for you and then just push slides.
I can do that.
It just wouldn't be fun without technical difficulties.
All right, so let's see if I can, because it's not a too big presentation. So
Okay.
let's see if I can share it. Otherwise, I'll just have to tell you about it. Do you have a Mac or PowerPoint?
That is a Mac. And then the other thing,
This is in Keynote.
yeah, perfect.
All right.
That'll work.
I'm about to
Great.
send it to you.
Wonderful.
It cannot send the file. Okay. You know what? We're just going
We're
to,
just going to punt.
yeah. All right. When we talk about the training that we've had, all of our veterinary training has been done in the allopathic world, which means that we focus on naming and blaming, and then we work on symptom suppression. And that's what most people are used to. In fact, your dog has a problem, your cat has a problem, you go to the veterinarian and you're expecting them to give you a pill for the ill or a diet for the disease. And that's the Western model. But the holistic model is actually not woo-woo. It is actually discussing the body as a whole. So we're looking at body, mind, and spirit. What I do is bioregulatory medicine. So what that is, it's more about looking at the body systems. How does everything work together to improve overall health? So number one, we still take a thorough history. And no, it doesn't sound so sexy for the veterinarians out there. They're going, oh, we want to have all that new and exciting stuff. And yes, it is new and exciting. However, we still have to do a thorough history, a thorough physical exam, and a thorough workup in order to be able to understand what's deficient and what's toxic and what's going on in the body. So the 6 steps to healing that I use, and I use it in wellness, I use it when I have an ill patient, is number one, we have to stop doing the things that are causing disease. There's no shortcut. If you are feeding processed food to your animal, you need to get them on a whole plant, a whole food, natural species appropriate diet, which in my opinion is going to be some form of a raw diet. And then we have to make sure that the water they're drinking is a good water. It's highly filtered, it's structured. We could spend a whole hour talking about structured water. But what structured water means is that it has a certain molecular shape. It's what the plants do when they're taking in sunlight in the morning and they have moisture and dew on them. They are actually changing that water to be structured and then putting it into the body. Our bodies use structured water. If we drink unstructured water, then we have to use metabolic energy to restructure that water before it can go into our cell, because our cells have this little film membrane on top of it, and there's a little aquaporin hole. Structured water fits into that hole. It's a beautiful little system, but unstructured water doesn't fit into that system. So if you're drinking a lot of water and it's not structured, or you're feeding water to your pets that is unstructured, their body's working very hard to try to restructure that. And much of that is not going to be structured. It's not going to get into the cell. So we remain cellularly dehydrated, which has a whole list of implications. Then we have to look at what is the air quality in the home. Is there a lot of electromagnetic frequency going on? Are you doing laundry in commercial products that are loaded with xenoestrogens? These are all highly problematic for our pets. And then last but not least, and the things that we need to shift out of the pollution category, are the ants that live in our brain. And ants are the automatic negative thoughts that we all have. I call it stinking thinking, but what it means is that we're stuck in this victim mentality. And when we're doing that, we are creating negative neurotransmitters that are communicating to our cells, telling them that there's danger out there, there's problems going on, and it changes the DNA that you're going to express. And our pets entrain to the energies that we're giving off. So if that pet is in a household where there's a lot of stress, a lot of anger, a lot of frustration, we're dealing with spousal problems, credit card problems, people are eating processed foods, all of this, sleep deprived. You just asked me about sleep, right? And so these are all things that lead to high sympathetic tone that create a plethora of problems. And our pets literally entrain to the frequencies that we're giving off. And that's not even a woo-woo principle. That's literally a
No, it's
scientific,
not.
it's entrainment. So when there's a bunch of girls living in a dorm together, they'll all start to cycle their periods together. That's how we tune pianos. And so this is really a very common phenomenon. And we are not cognizant that we are creating this for our pets. So that's all pollution: food, water, air quality, what touches their skin, what the electromagnetic pollution is involved. And then, of course, we're dealing with all of the EMF. So Now we get into nutrition. So step number 2 is we need to provide the essential nutrients. The difference between the nutrients that our body can manufacture and the essential nutrients are that essential nutrients cannot be manufactured in sufficient quantity by our body or our pet's body. So we have to eat them in our diet. And I think that's pretty interesting that we have this amazing machine that we call our body, and it can do so many different things. It can regenerate itself, it can repair itself, it can make new tissue, it can make new blood cells. But there are a few things that are limiting, which are these essential nutrients that we have to eat in our diet. Well, we know the food that we're eating is nutrient depleted, so we have to be able to supplement that. I think in today's day and age, that isn't even a question anymore. So we have to supplement the essential vitamins, minerals, fatty acids, and amino acids in order for the body to be able to function properly. And then number 3 is healing the gut. Now, I'm pretty confident your audience would know what leaky gut is, but just in case, for those that don't, we have these cells in that line our gastrointestinal tract, and they stick together and they have a cheesecloth like membrane, and it filters everything coming through the gastrointestinal tract. It filters it like a piece of cheesecloth. So only certain molecular sizes are allowed to come into the body through that tight junction. But when we damage that tight junction, like taking a pen and banging it through your cheesecloth, and now you've got these big holes, now things can come into the body that weren't supposed to come in. They travel to the liver, and then the liver sees that as a foreign invader, and it mounts an inflammatory response. So this is literally the crux of inflammation that starts the entire cascade of unwellness, is that we have this chronic, insidious inflammation that is happening. And when our pets are eating processed foods, the high sugar in that processed food, it's enzymatically dead. There's a lot of hormones, chemicals, glyphosate, all these things are coming in that are damaging these tight junctions, leading to more and more inflammation. So just imagine that every bite of every meal that you or an animal is consuming that is not supporting your health is creating this damage, creating this inflammation, and leading to this insidious decay of our body. Then we go into detoxification, and this is my passion because I just love detoxification. It's something that we really weren't educated on in medical school, and yet it is so vital to how the body functions. So we have 6 organs of elimination. We have the kidney, the colon, the lungs, the liver, the skin, and the lymphatics. Now, I include the fascia in with the lymphatics. What happens is these organs get overwhelmed. Just as an example, since 1942, the end of World War II, we have had over 85,000 synthetic toxins introduced into our food and our water systems. Our bodies just weren't designed to handle that level of toxicity. So what happens is the body goes, oh, I can't handle all of this toxin. So instead of being able to eliminate it, it starts to store it in fat. But it's not innocuous in the fat. Now it has this slow leaking of things that are getting out into the system. And we're talking heavy metals, we're talking all these glyphosate and other toxins that are coming into our body that we're not aware of. Take heavy metals as an example, mercury. Now, I had mercury fillings when I was young. I had had them all removed because I was having, the only health issues, thank God, that I had were allergies and dry eye. The symptoms can be different for everybody. Some people have a lot more sensitivity. We're doing heavy metal testing for our animals, and I'm finding that even in animals that are theoretically healthy, we're finding anywhere from 3 to 6 or more significant levels of heavy metals. And these are in animals that are as young as 4 months of age. So it's a serious problem. And what's happening is these animals are coming to the doctor. I'll give you an example. I had a 4-month-old dog that came in for limping. He'd been to their regular vet. The regular vet said, oh, it probably has arthritis, or it has, they actually called it Legg-Perthes syndrome, which is a deterioration of the head of the femur. And I look at the x-rays, I don't see the same thing, but I do a full workup on this dog. Massive nutrient deficiencies, including vitamin D and magnesium, and a toxic load of 5 heavy metals. So we fixed that and all the symptoms went away. Had another dog recently, a year of age, comes in with a rash. the average veterinarian would have put him on antibiotics, given him some kind of a steroid or a cream or some anti-itch, and would not have fixed the problem because this dog was deficient in almost every nutrient we tested, severely deficient, and it was eating processed foods. So we fixed the deficiency, took care of the heavy metals and the other toxins, and the rash went away. So it's really important that we learn how to understand what's causing the root cause of disease and then be able to address that. So detoxification of all the organs are amazing. And I have this amazing presentation I was going to show you on fascia. It was a little dog that took 2 steps forward. The dog was about 3 years old, and it didn't make it when he went to jump on the bed. And so it had injured himself, and within a day started walking like it was in an L shape. So it'd start to go forward, and then the hips would just swing out because he had this big, massive amount of contraction and spasm on his left side. But he didn't cry in pain. So every time he would walk, he would just walk like he was in the shape of an L. So I ended up treating the dog by releasing the fascia and doing a chiropractic adjustment. And within 6 hours of the completion of the treatment, the dog was walking normally and it had no relapses. So these are things that we can teach pet parents how to do, is work with the fascia. I have a whole program on how to do fascia decompression. It's amazing how much problems we're seeing because the fascia, which is the stuff between everything, it's between the cells, it's between the muscle holding to the bone. And when the body starts to become structurally unbalanced, this fascia starts to grip down and hold. And then you get this inability of the body to communicate through that fascia because that's where the structured water is flowing through. So you get this miscommunication from the mitochondria, which are the packets that make all of our energy, to the microbiome, all the organisms, and you're not getting energy flowing, you're not getting communication flowing, and things are just getting stuck. So we're seeing the symptom of that is osteoarthritis or skin disease or ear infections or gastrointestinal disease. But the root of the problem is going to be 3 basic things. Number 1, the body has a deficiency of essential nutrients. Number 2, there's an overwhelming amount of toxins that can't be gotten rid of through the detoxification system. 3, mitochondrial dysfunction. There isn't enough mitochondria making energy and or being able to communicate to the rest of the body. And then, in my opinion, number 4 is actually having trapped emotions associated with these dis-ease processes. So that is, in a nutshell, we stop the pollution, we make sure all the essential nutrients are there, we heal the leaky gut, we improve detoxification of all 6 organs of elimination, we improve mitochondrial activity and function, and then we clear trapped emotions. So that, in a crux, is a majority of how we actually heal the body, not just symptom suppression, but truly understanding the root cause of disease. Now, I said it like it was a real simple process, and in my opinion, I think it really is that simple of a process. But it takes a little bit of knowledge and understanding of how to work within those systems. So if you're going to test, you have to do the right test. If you're going to use the right tools, it's like anything else. If I'm going to do surgery, I'm not going to do surgery with one tool. I'm going to have all the tools I need that are specific for that particular situation. That's what detoxification does as well. Any questions at this point? Because then I'm going to go into the tools that we use for detoxification.
No, and I think what you're saying is really, really important because the other key thing is that while humans have a huge toxin burden, cats have something like 93 times our burden and dogs have up to
Yeah.
68 times our burden.
Yeah.
So it's no surprise that you're treating a puppy at 4 months of age. I think all of this gets transferred from mom into puppy because we are sadly living in a world that's just overwhelming us with
Yeah.
toxicity.
And we're not going to get rid of it. We're not going to
No.
just live in a bubble, right? So we have to develop a lifestyle. And that's what, to me, what health is, developing a lifestyle that encompasses these 6 principles. So for myself, I eat all organic and I'm very conscientious about what goes in my mouth. I'm very conscientious about what I do my laundry in and how I clean my house. And we use all healthy green products. So I'm minimizing the amount of toxicity. And on a daily basis, I'm feeding my cells. I feed my cells before I feed myself. So what do I know that they're going to need to do their job? I make sure that is in my diet first. And then I do detoxification every day. Maybe it's sweating, maybe it's high intensity exercise, maybe it's coffee enemas, it's ozone, it's magnosphere, it's whatever I need to be able to allow my body to do its job properly. And at almost 70 years of age, I can thankfully say I have no health issues. I have absolute vibrance. You ask me, do I sleep because I get so much stuff done? The amount of energy that I produce is ungodly wonderful. And I think it has everything to do with the fact that I'm living a lifestyle which includes staying in bliss and gratitude and joy. I'm never a victim, never a victim. Even the interesting unfolding of how this happened today, where I didn't have my computer in time, all of that was just, wow, what was the universe telling me? Maybe slow down and pay more attention to the details. But whatever it was, it all works out because I just accept it and move on. All right, now let's get into some of the tools that we can use. So one of the first thing that we have to do is get into a parasympathetic state. So let me describe the autonomic nervous system. We have two branches, and imagine they're on a teeter-totter from each other. When one side of the teeter-totter is super turned on, the other side is turned off. So we have our sympathetic side, which is the side that helps us survive danger. It allows us to run hard, fight hard. It's when the saber-toothed tiger is chasing you, it's the one that allows you to go into action and not think about what you need to do. You just react out of your reptilian brain. The other side is your parasympathetic side. Very important because this is the rest, repair, digest, detoxify, and reproduction side. But they're on a teeter-totter. So if you're in balance, then that's okay because you can float in between them. But for most of us, it's not being in balance. It's the credit card stress, it's the kids and the fights with the spouses and the processed foods and the work stress and the sleep deprivation, and all of that is our saber-tooth tiger. So we don't recognize it at the saber-tooth tiger, but it is doing the same thing. It's keeping us in high sympathetic tone. And when that happens, it turns off our parasympathetic nervous system, which is the only system that allows us to heal. This is so hugely important. I hope you understand that. Now, there's recent information that helped us to understand in humans why some people, even though they were doing all the right things to heal, they couldn't heal. And what they discovered was that the vagus nerve, which is the nerve that turns on the parasympathetic nervous system, actually has two branches. The dorsal branch is the branch that turns on the parasympathetic nervous system. Fabulous. Your mitochondria are happy. You're able to detoxify. You're making a lot of energy for the body to use. Everything's doing well. But with people that are constantly in high sympathetic tone to the point where they can't get rid of their victimhood mentality, they can't get rid of the stress, and it's so overwhelming, it triggers the ventral root of the vagus nerve to turn on the cell danger response mode. So we've all heard that expression about possums. When the possum thinks he's going to die, he rolls over and he plays dead. That's what happens in the cell danger response mode. The body is so overwhelmed with the stress that it thinks it's going to die. So everybody goes into shutdown mode. The mitochondria go in the bunker. They can't hear you. They can't see what's going on. They're waiting for the storm to pass. And if the body survives that and they can come out and go, oh, look, it's sunshine again. All right, then we're all back in good standing. But when you get stuck in that cell danger response mode, nothing you do is going to get you better until you can repair the nervous system so that it can go back into parasympathetic. Now, why is that important for pets? Is because there are so many pet owners in today's world that are stuck in that cell danger response mode with chronic illness, chronic issues in their life, trauma from their past, trauma from their present, and that's in training to our pets. So we have a machine. This is where I start my entire healing program, is with this parasympathetic machine. You just sit inside and it creates these frequencies that put you into a theta brainwave, and it just relaxes your body. You literally go in there and the animals just to start, they fall asleep, the owners fall asleep. It's pretty amazing how it can just turn off that cell danger response mode. So that's one of the tools we use. We also have sound frequencies that we can use. And I was going to show you some videos. Maybe Dr. Ruth, we're going to have to do another Facebook Live and give me grace for trying this again. Where, or maybe I can just post the video for you. I'll do it and we can just post it on your Facebook or something so people can watch it later. Elise, my partner here, she can actually maybe put it to where people can ask for the download and we can send it to them or something like that, because it really is a magnificent presentation to show. I have a dog that was so wired it couldn't be held still, and we play this frequency music, and in 3 minutes he lays down on the table yawning, eyes heavy, and I can do his whole adjustment and he doesn't move. You don't even have to hold him. And then I have a little bird that was very angry about getting his beak trimmed, and we play the music and he just calms down, and then he puts his head out for me to pet him, and he's cooing at me instead of screaming at me. It's really magnificent to watch. And then I have another machine that also produces frequency. We are frequency. We are a big blob of frequency made up of 70% structured water, and then we have the skin wrapped around us. Okay, so when we're talking about how important it is as light beings that respond to frequency, when we use those tools to help heal the body and train it back to its normal, it's ridiculously amazing how easy the body wants to heal. And our pets even more so, because they don't get in their mental way. So when we treat the animals, they're like, ah, thank you, I feel better. When they're better. They don't have to think about it, and they don't have to go back into their past and go, wow, I was hurting 10 minutes ago. Maybe I should go back there, or I can't understand why I'm better. So did it really work? It just works for them.
Yeah.
All right, so we talk about doing different frequency works to get us in a parasympathetic state and train our tissues back to their normal frequency. And then the fascia decompression, I told you about that because it's just amazing to watch these animals change between chiropractic work and fascia and sometimes electrical stem acupuncture. It's life transforming for these animals. And then what else did I have in here for you? Oh, infrared therapy. Now, I am a big believer that God and nature are way smarter than human beings. And whenever I look at what is the right answer, I look to nature and say, what is the model out there? Our big, beautiful sun produces full spectrum infrared. That's what I like to use when I'm treating my animals, because I think we are a very light deficient community because we live indoors all the time. We work indoors for the most part. A lot of people go to work when it's dark. They come home when it's dark. So they're really not outside the way our ancestors were. And our pets oftentimes are inside a lot more than they would ever have been. So I think we're light deficient. We're certainly immersed in frequencies that are disruptive. So look at the two things that we've just done. We've put ourselves in this high sympathetic state. We're nutrient depleted. We're full of toxins. We're not getting enough light. And we have these frequencies that are bombarding us that are putting us out of our normal cellular alignment. So all the things that I'm doing are putting us back into that proper alignment. So I use full infrared therapies, and I have a pad because it's not fun to do a sauna when you're hot and sweaty and then with a animal that's sticking to you with their fur. And I'm sure it's comfortable for them either. So we have a pad that is full spectrum infrared. We can adjust the temperature so it doesn't have to be too hot, and it produces negative ions, and they love it. They will actually go over and get on the pad. And then when they've had enough, they'll get up and they leave. Pretty remarkable how intelligent they are. So we do infrared therapy. We also do lymphatic therapy. This is another area I'm highly passionate about. So we talked about the fascia and how important that is. The lymphatic system runs through the fascia. So we have a machine that produces a microcurrent and negative ions and these inert gases, and what the glass probe. And as we are holding it over the drainage points where the lymphatics drain in the groin, the armpits, and subclavicular areas, it acts like Drano. So it starts to thin the fluid and allows it to start to drain. And then we decongest the areas of the body that appropriately drain to whichever area that it's supposed to drain to. And then we decongest that area and we sweep all of that lymph into that drainage area. And then we help it to go down the drain. So that is something that I've also found is not done in the veterinary world very much at all. In fact, I think it's only the veterinarians I've trained that actually do this procedure. So it's really important because the two most important organs of detoxification, in my opinion, are the lymphatic system and the liver. And it's because they do the most work. So all your immune system, your T lymphocytes are all coming from your lymphatic system. And then it's a major part of your drainage. It drains the whole body. So very important that we have healthy lymph. And then of course the liver, because it has hundreds of jobs to do. And when it becomes overwhelmed, it starts to be unable to do all of its jobs properly. So I'm going to give you another thing. If you take your animal to the veterinarian and you have your standard blood work done, always ask what are the numbers of the liver enzymes. A little older than Dr. Ruth. And when I started in practice 40 years ago, the normal range for liver enzymes was 45 to 90. Over the years, the laboratories keep making a bell curve based on the numbers that they get. We have more unhealthy animals now than we've ever had. So this bell curve is shifting because this unhealthy population is skewing that bell curve. I don't want to have my animals compared to unhealthy animals. I want to compare them to the healthy population that we know they should still be at. So when I look at liver enzymes, if they're below 45, I have a problem with that. I know that liver is being bogged down and it's not able to do a good job. We are seeing liver enzymes below 18. Now, 45 to 18, that is a big drop. So always ask your veterinarian to show you the blood work because they're going to tell you everything's in normal range if it's above whatever that low number is. But
And they often tell you it's normal even if it's out of range, right?
sometimes, yeah, but it's really scary to me that I see these animals coming to me for second opinions and they have liver enzymes that are down in the teens. And people have no idea because they were told everything was working fine. And it's not the veterinarian's fault. So let's not go blaming and shaming. It's because they're looking at numbers and they were trained to look at the numbers. And that's what they're being told is normal. But when you're in our age bracket and we knew what normal was back in the healthier days, we know how to compare that. So that was one big tip I just want everybody to be aware of is that most of the animals that I see aren't anywhere near normal liver enzymes. So what they're measuring is the turnover of liver cells. So inside the liver cells, there's an enzyme that we can measure. When the liver is functioning and it's revving up and it's doing its job, there's going to be a certain amount of normal turnover where some cells are going to die and then new cells come in. But when the liver isn't functioning, then it's not turning over as many cells because it's just bogging down and it can't do its job. So that's how we know that there's a problem. Now, once you make that liver really angry, either because you traumatize it or there's a toxin that kills off a bunch of cells, then the number goes up. And most veterinarians will recognize an elevation as being abnormal. They're just not recognizing the low numbers as being abnormal. So off on that tangent. So we do infrared therapy, we do the lymphatic therapy. After we do the lymphatic therapy, we get everything stirring around and like mixing up the pot. Now we want to drain it all out. So we do an ion foot bath, which not only pulls toxins out, it uses electrolysis to pull toxins out through the skin, but it also helps aid in creating a parasympathetic state. So it has two great benefits. And then we use ozone. I don't know how I would practice without ozone. We do it in a rinse. We do it intravenously. We do it as an injection subcutaneously. We put it in joints. We put it everywhere you can imagine. So what a fabulous tool, and it's a natural product. So maybe on another day we can do a whole talk on ozone because that's a real big passion of mine. And then we do hyperbaric oxygen therapy because again, it's all about the terrain. This is the world that all of our organisms live in. It's on our body and in our body. And so we have to have a healthy terrain for all of the world to live in properly. So parasites and bacteria and fungi, they're not our enemy. What happens is when our terrain, the soil that everybody's living in, becomes so deteriorated that the good organisms can't survive, like in a garden, the weeds start to come in because somebody's trying to stabilize that environment. So now we see pathogens coming in because somebody's trying to survive on that world. So I think it's extremely important to understand that principle, and we look back at what are we doing to keep our terrain healthy. That means a healthy gut, a healthy microbiome, healthy working organs of detoxification. All of that needs to be good. So everything works better in oxygen. Hyperbaric oxygen is a modality where it helps to, under pressure, pushes more oxygen out into the tissues, out into the terrain where everybody gets to enjoy it. So that is a very big principle that we use. And now hyperbaric oxygen has become so affordable that pet owners can actually buy portable units for their home. Almost every one of my cancer patients, their owners will buy a hyperbaric chamber so they can do it twice a day for their pets at home. It's a little pricey, but nothing compared to what it would cost in the olden days with these hard chambers. So I think that's super important. Salt therapy is another thing that we do. It's called halo therapy, and it's where we have a booth that looks like a phone booth, and we aerosolize sodium chloride. It's a medical grade salt. And when you breathe that in, it acts like a toothbrush, cleaning the air passages all the way down into the small air passages of the lungs. Great when you have chronic colds or viruses or bacteria, pneumonia, lung cancer, all of that. It just creates this environment that doesn't allow bad things to grow. It's also wonderful for the skin. So of course you're in there breathing it, but it's also falling down on the skin. So for our animals that have chronic seborrhea and skin disease, it's fabulous for helping to create a better microbiome on the surface of the body, along with the ozone and all the other things that we do. And last but not least, I want to talk to you about is low level light therapy, which is where we take the visible light spectrum and we use it therapeutically. Now, I have a laser that is used intravenously. It literally goes a little fiber optic through an IV catheter into the body, into the vein where the blood vessel, the blood cells go past this fiber optic and absorb the light. Different colors of light from ultraviolet to blue, yellow, green, red, and infrared all have an activity on the body. Now remember, this is all what the sun produces, all these different colors. We didn't make them up, but now we're using it therapeutically to change the enzymes and the metabolic activity within the body. Then what we can do is add a photo activator. We'll add a product. It could be intravenous curcumin or vitamin C or hypericin or mistletoe. There's so many different things that we have available to us. And when we add that intravenously and then we add the light, then it's called photodynamic therapy, because now we're activating these products that we just put into the body and making them way more enzymatically active. And now they're going after pathogens. They're killing off cancer cells. They're killing off bacteria that are not supporting the body, the pathogens that we have now taken over because the terrain became bad. So they're the weeds coming in, if that makes sense.
It does.
So I am so sad that I can't show you my slides because I couldn't figure it out. But again, if anybody wants to private message me, I will show them this presentation because it is really remarkable to watch. And we have lots of videos out, and this is not new information out of my wheelhouse, but it is really impactful. And then we have a pet parent course for the pet parent, which of course teaches them all about this in much more detail and how to implement it. Because I find that I've never met a pet parent that doesn't want to do the right thing for their pets. But you know what when you don't know what you don't know. And I literally had this conversation with a rep last night, And when we get belief systems, and a belief system is simply a thought you keep repeating. So if you hear something that does not coincide with your belief system, you're immediately going to go, oh, I don't know. I don't jive with that. What do I do? I'm going to turn off this little camera thing. So you start to reject the information. But when you ask the question, where did that belief system come from? Most of our beliefs came from our birth to 7 years of age by simply observing. We were like a little computer absorbing everything we saw our parents do, our caregivers do. And then when we were in school, we learned what our teachers taught us. Maybe that's not accurate information anymore. Maybe there's a new paradigm that might benefit us in today's world, because we're living in a world like we've never seen before. There is so much more chronic disease. There is so much more, not just chronic, but complex diseases. Cancer rates in dogs are almost 100%. Cats, 1 out of 3, highly underreported. Almost every animal we see has some form of illness: osteoarthritis, obesity, gastrointestinal disease, you name it. They're just not healthy. And so we need a new way of thinking. We need a new paradigm. Einstein said, you can't solve problems with the same mindset that created them. We came from a world of fast, cheap, and convenient. We grew up in that world, and processed foods was part of that, because look, now you have a box that can stay on the shelf for 20 years and then you can still eat it.
Yes. And it's true. And interesting, Dr. Gabor Mate talks extensively about this in The Myth of Normal. And that's part of what he, as a physician and psychologist, does, is help his patients question, where did that belief come from? And what if somebody told this belief, this story to your niece? Would you, and she came and asked you about this, would you say, yes, that totally makes sense, or no, it does not? And so that's one way to start to undo our belief systems, and especially about our pets. So what I kept hearing from so many of my consult clients is my vet said they'd done all that could be done,
And there's
and
nothing
and
more.
and
Mhm.
there's nothing more. And now the option is euthanasia. And so I think this is so critical to take a deep breath when you receive that news and say, thank you, doctor, and start looking for other options. And thankfully, there are so many options out there.
Yeah. Dr.
Now, there,
Rich, I don't know if you knew the story about how I even got into integrative medicine, because I didn't start out this way.
no, none of us did.
Yeah, and my daughter, my youngest daughter, had a riding accident on her horse. And when I had equine vet, so the horse reared in the air, and my daughter wasn't told to just get off and get to safety. And so the horse was going to fall over and crush her. And by some fate of blessing, this horse squatted on her hind leg and pushed herself as hard as she could to the opposite direction of where my child was falling. However, when she hit the ground, when the horse fell over, you couldn't see space between the two of them. So I'm jumping over the rail. The horse gets up. She's okay. And my daughter wasn't moving. Thank God she was fine. But when I had equine veterinarians come look at her, because there were more incidents that happened after that, they said, Dr. Siegel, we don't know what's wrong with her. All we can tell you is she's never going to be safe to ride again. She'll never be shown. And you can put her out to a pasture or you can put her down. And that was the impetus that changed my life forever. It changed my personal life. It changed my practice life. And I made a commitment, and I've held to it all these years. Never, ever utter those words to somebody, because there's always something you can do. It simply means you don't have enough resourcefulness if you're going to say there's nothing more that can be done. That's a Tony Robbins quote, by the way. There is no failure. There's just a lack of resourcefulness. That's what drove me to all the modalities that I have. And back then, the veterinary industry knew nothing about this. I went into human functional medicine, which was in its infant stages then as well. But I was a sponge. If I thought I could take a tool and use it, I didn't care if it cost $100,000. I didn't care if it cost $25,000. I bought it and I figured out how to adapt it to the animal. And I had so many companies go, I don't know, Dr. Siegel, we don't know how to tell you to use it. And I said, you don't have to tell me how to use it. I'll figure it out. I just want the tool. And
Right on.
truly, that's where I started.
Yeah, and that was my path as well, getting into the human side because we didn't have the answers on the veterinary side. There are a
Yeah.
couple of really good questions I wanted to go back to, and Lori's asking about the names of the liver enzymes. And I think really the best thing is just get the whole report, get the veterinarian to send this to you. Because whether you're working with an integrative veterinarian or whether you're working with a holistic pet health coach, they can help you decipher what this stuff means. You
Yeah.
can look at it and go, oh my God, there's all this red on here. What does this mean? And then that way they can get you some information. And then Audrey, one of our holistic pet health coaches, was asking about PIMP therapy in terms of resetting. And I think that pulsed electromagnetic field can be a really valuable resource. And that's part of what I love about PetsPimp and OmniPimp on their human side is that they actually have settings to put you into a theta state, to put you into a delta state. So you can absolutely use this type of modality to help move you into that parasympathetic state.
I do want to make a comment about PEMF devices, though. A majority of the devices that are available in the market have high frequency. And you want to look for those that are low frequency. Like the machine I use is Picatesla. It is tiny, very low. It's in training the body to come back to normal. With a lot of the high PEMF devices, it's an interruptive type of like it cuts the signal. So for a few minutes you feel better, but it doesn't really fix the problem because it doesn't bring the tissue back into its normal state. So that would be my
Yeah,
only caution when dealing with PEMF devices. They are not all the same.
agreed, agreed. And that's why I love this company because they are the main researcher, Dr. Yerman out of the Bion Institute in Slovenia, that is his concern is not only the frequency and the intensity, but also the shape of the wave so
Yeah,
that it helps to bring the frequencies back into coherence. But you're
yeah.
right, because there's like the big gun stuff, and they can be useful. But if our goal is to regain a state of coherence and harmony and homeostasis, that may not be the best approach.
And the goal is what you just said. So we need to be thinking about what are we doing to the body.
Amen. Amen. So, one of the things as we're winding up here, you have a beautiful free course available, and I'll drop it here in the comments so we'll get it out to our YouTube and our Facebook folks, which is a free ebook about 5 keys to healing. And so, we talk a little bit about that and what's in that download.
So it downloads the 5 steps that I started with, stop polluting the body, and has a lot of detail in it. The essential nutrients, the healing the gut, the detoxification of the 6 organs of elimination, and the mitochondria. The only part that I don't include in there is the emotional part because it's really hard to explain trapped emotions. And I thought it was a little overwhelming for people. So I limited it to the 5 steps, even though there are technically 6, but it's still a plethora of information.
Right on. And lastly, for those of you that are just starting on this journey um, to detox your home, apologies for this hideously long link, but our friends at Truly Free have made house cleaning and laundry much, much, much safer.
That's
So
what
check that out if you're getting started. But they have just been amazing in terms of, and it looks like it broke up that link in crazy sections. But they have really nice products. They're very eco-conscious and just do amazing stuff. Dr. Siegel, thank you so much for joining us. We're reaching the end of our time. I think this is definitely going to call for a another session. You
Let's
just have a few more things to share, right?
Yeah, I know. I got tons. I could go for hours and hours. Yeah.
Right on, right on. Cool. Thanks so much. Thanks to all of you for joining today. There's been wonderful conversations here in the chat. So delighted to see you all, and we'll see you next week. Take good care.
Blessings, everybody.